The Chicago business scene is as diverse as the city itself. But we don't always hear from the entrepreneurs who keep the Chicago economy colorful. That's where I come in. I'm Micaela Brown, and this is the Minority Report. Dr. Julius Few won't tell us which celebrities have come under his knife, but as one of the preeminent plastic surgeons for ethnic women, we can make a few educated guesses. We met the good doctor at his stylish office up in the John Hancock Center, and we weren't the only ones. Dr. Few had a long list of people visiting him for his services. Between appointments, we talked about why plastic surgery must be tailored to women of color and how reality TV has affected his profession for the better. So how do you explain to your children what you do professionally?
I show them videos.
You show them videos of you doing breast augmentations.
That was supposed to be funny.
Oh, okay.
No, no, not all of what I do is purely beauty related. I do work that helps people kind of get back kind of on track with their life. And so.
What do you mean by that?
Meaning they may have been in an accident, they may have had something happen that was unexpected, and I get to put them back together, and the kids think that, of course, is very cool.
So what has been one of your most impactful reconstructions due to maybe an accident or what have you?
A guy came to me with a very difficult problem. An orthopedic surgeon needed some kind of replacement for bone in his spine. And basically I invented an operation to help put his spine back together. So it was a living piece of bone that we moved from basically his rib to his back. And so that was a big deal. I was very excited. It had never been done.
So if you have a friend, right? Really good friend.
Yes.
Face may be slightly, you would be honest and say, hey, I would fix something.
If they ask. And that just came up. I have a friend that I went to college with. We're like brother and sister. She finally said, what do you think? And then I told her what I thought.
So I know that you say yes to patients as much as you say no. Why is that?
Because I like sleeping at night. At the end of the day, I don't do anything that I can regret. And they're ultimately looking at me as the instrument to deliver their dream, often their dream. I mean, this is what kind of responsibility I have, is kind of often to be a dream maker.
This wouldn't be the Minority Report if we didn't talk about your ethnicity.
Yes, I am black. Next question.
Being an African, you can't be rolling my questions. Being an African American male in such a highly glamorized field, have you faced adversity with your credibility because there aren't many people that look like you doing this practice?
Early on, yes. Luckily, I was in a great hospital with a great reputation, and the fact that I was brought on was not because I was black. It was because I was good at what I do. At the same time, I'd walk into rooms, I looked young, and some people would say, black and white actually, who would say, when's the doctor coming in? That would happen. That has happened. Now, luckily, I'm more well-known. People know what I look like. They know what I'm about. And so it doesn't really happen now.
I learned that you have a specialty with rhinoplasty in reconstructing the nose so that it still has an ethnic feel and making the woman happy. Why did that come about, and what are your thoughts on African American women wanting to change the way their nose looks?
When I first came out after training, the definition of a pretty nose was only one definition, and that was typically a Northern European nose. And ultimately, I feel the worst thing somebody can do cosmetically is to do something where it makes them look as if they've done something. And so what I did is I did the first study that looked at this issue. So everything that I'm talking to you about, I've got science behind it.
I may or may not be a reality TV junkie. How do you feel that reality television has shaped your business, and is it good or bad?
The whole reality TV side of things has probably been more good than bad for plastic surgery. I'm going to explain that.
Okay, well, let me hear it. I'm
going to explain it from the standpoint that, number one, it has shown some really bad work. And what that has done is force people to have an open dialogue about what's good, what's bad, what's involved in plastic surgery. On the other hand, somebody who comes out who is in reality TV that does really good work or has really good work done, and they say, wow, you can actually do that. I didn't know you could do that. Really?
I slung a whole lot of lipstick.
Good.
And skincare.
Oh,
I've been using Micae since I was like
So is that why you
18.
still look 19?
I know, thanks.